Good morning, everyone. So my name is Emmanuel. At Shade, we've developed the first semiconductor to measure UV exposure for health accurately. So although we do not analyze images directly, we do analyze electromagnetic spectrum, and we use techniques very similar to multispectral image analysis that are being used in computer vision. So the problem is very simple. There are a variety of diseases for which we know UV exposure has an impact. So we know UV exposure can cause skin cancer. We also know that it can impact oncology treatments. And finally, we know that for some autoimmune disorders, UV exposure can have dramatic consequences. Among all these diseases, melanoma is unstoppable. It has been the fastest growing cancer. And despite every effort from the sunscreen manufacturer, it's still growing at a fast pace. It has tripled over the past 30 years. If you go to a physician for a UV sensitivity, you will hear the same advice over and over, despite your specificity, which is do not go outside and really best of luck. That doesn't work. That's never worked. And so the solution we propose, of course, is to equip patients with a clinical grade sensor, a mobile application, and smart notifications so that they stay ahead of consequences. Because with UV exposure, when you feel the consequences, it's already too late. Of course, to build consumer trust and to impact behavior, you need accurate data. And next slide. Today, Shade is the only accurate sensor available on the market by at least an order of magnitude. Even compared, for example, to companies like Microsoft, who tried to measure UV exposure but failed. As good scientists, we publish our data in a peer-reviewed journal that is accessible here. As mentioned in the introduction, we've logged now over 2 million measurements of UV, and so we can start noticing behavioral characteristics among patients and across diseases. So here, everything is anonymized, obviously, so we can't see much, but if you go into the details, you will see the specificity. And this kind of data does not exist today and is a goldmine for pharmaceutical companies who need to ensure the efficacy of their top-of-the-shelf drugs like oncology treatments. Of course, when you talk about personal medicine, you think immediately about genetics, which was mentioned just before. And I want to give you an example that I like. So if you take identical twins, so they have the exact same DNA. And only 15% of both twins will develop melanoma in their lifetime, which means that 85% of melanoma is triggered by the environment. The NIH, the National Institute of Health of the US, recognizes that issue and is launching an unprecedented initiative to follow 1 million Americans over 10 years to understand how genetics and the environment impact the disease and specifically cancer. I would like to finish by acknowledging our partners. So first, the academic partners with whom we run clinical trials. While Cornell Medicine, we have a large trial on skin cancer going on. I'd like to thank the government agencies, so the NIH, specifically the National Cancer Institute. We've received a phase 2 grant from them, and the National Science Foundation, which is funding our technology, and of course, our private investors. Thank you very much.